Hello. Good evening, fellow friends and loved ones. Yes, it's once again a very great privilege to come to your homes, to your offices, into your cars, wherever you are going. I'm sure most of us are going home and we are in a vehicle or transport, or we are at home relaxing and preparing for the evening. Yes, it's once again a very great privilege to come to you as we continue our health discussions. Yesterday we had a prelude of today's discussion. I'm sure today we'll have a very extensive discussion on this condition. So the foot, yes, so metatarsals. That's something called metatarsals, and this is actually a part of your foot. Specific location is the middle part of the foot called metatarsals. So we have actually three portions of your foot. Every person or every human being who hasn't got his leg cut off or who has the leg intact has three portions of your foot. You have the first one is the front part, and the one in front is called the forefoot. The one in the middle is called the midfoot, and then the one behind is called the hindfoot. That is actually three portions of your foot. So this condition called the metatarsalgia affects mainly those closer to the forefoot, but then the metatarsals is found in the midfoot. So the metatarsalgia occurs in between the forefoot and the midfoot, the joint in between the forefoot and the midfoot. So that's called the metatarsophalangeal joint. Okay, so the forefoot comprises of toes, that is scientifically called phalanges. Then the midfoot comprises of bones called the metatarsals, and the joint between the metatarsals and the phalanges is called the metatarsophalangeal joint. And that's where the metatarsalgia occurs. We're showing some pictures to understand the detailed condition, the presence of the condition. So what is it? It's actually the condition. Okay, then the last one is the GIA. The GIA is pain. So if you hear anything of GIA, it's mainly relating to pain. So we could have anorexia, we could have probably tarsalgia, which is actually around the hind foot, behind the foot, the location being behind the foot. We have bones called the tarsals, and so if you have pain around the heel region of your foot, it's called the tarsalgia. But we're talking about metatarsalgia today. So it's actually presented by pain, and actually in the first few weeks we could have inflammation. That for the first few days, between 3 to 7 days, we could have inflammation. where we could have pain and inflammation. And this condition actually really hinders the person or the individual from working and even carrying out his daily activities. And this is very, very important. So the first instance of pain or any complaint of discomfort around the foot region, every individual is supposed to report to the medical practitioners, the physiotherapist, to be able to manage the pain and reduce the pain. It's very, very important that we take note of it. Any complaint of pain under your foot, you need to report to the physiotherapist to be able to manage your pain and relieve your pain so that you can return to function. This is one very, very important. There are so many conditions under the foot that may look like this condition called the metatarsalgia or the forefoot pain, and this is very important that we as physiotherapists be able to clinically diagnose this condition. And so when it comes to see a physiotherapist, we are going to carry out various assessments, and then we do various investigations to confirm this condition called metatarsalgia. So it's actually common with people who are involved in activities that means either walking a lot, or probably those involved in activities such as basketball, those who jump. So as you jump, you are likely to land on your forefoot first, because when you land on your heel first, you're likely to cause a lot of pain right onto your back. So most basketball players land on their forefoot just to reduce the impact on the whole body. Aside the basketball players, we have also those who walk a lot. Yes, those who walk a lot. And it could also be as a result of other secondary factors, which we're talking about now very soon. And we have 3 types of metatarsalgia, which we're talking about very soon. And so, what are some of the causes of this condition called metatarsalgia? We have one called interdigital pain, where we have in between the bones called metatarsals, we have them coming closer to each other. So if the bones come closer to each other, they could cause them scratching of themselves, and this could cause this condition called metatarsalgia. We also have something called sesamoiditis. So under the first bone in the midfoot, we have some small bones, 2 bones under it, called the sesamoid bone. And these are very important bones just to reduce the impact, because when you are walking, immediately you put your heel on the ground, you go to putting your whole foot on the ground, then you raise the heel off the ground, and then push yourself with your toes in front. These are all face stands or faces during walking. The heel stands, where your heel touches the ground, where your foot goes on the ground, that is foot flat, and your whole body comes in the middle, called the mid stance. And then you raise your heel, called heel off, and then you push your toes forward to help push your whole body, called the toe off. At the point where you're about doing the toe off, that region of your toes between your midfoot and your toes are very critical, especially the first toe, that is the big toe. These sesamoid bones actually help to cushion the body and also to allow you to move forward very, very effectively. So in the case where they are inflamed, they could cause the metatarsophalangeal joint also to be inflamed in terms of causing pain, and these could be very, very detrimental. This could cause you probably not to be able to walk for a while, and it could cause discomfort during walking. And so when you notice that you have pain around your foot region, especially the metatarsophalangeal joint region or metatarsal region, you need to report to the physiotherapist. Very soon we're showing a picture of this actual condition where it occurs in a pictorial form. So we have so many causes. You could have aging. So you can have aging where we have the wear and tears of the structures under your foot, and this will cause pain. So let's pause and look at some of the pictures, anatomy of this condition. So just a minute, we'll look at some pictures showing your foot and what we talked about, the forefoot. Okay, so just a minute. So so this is the forefoot. So this is a side view of the condition. So you can have you can see the red signal there. You can see it there. So that's the metatarsal head. Okay, so you can see it here, the metatarsal head. Yeah, and then you can see the heel bone. So the heel bone region forms the hind foot. And this portion is called the metatarsal region. So this bone is called the metatarsal bone. You have 5 of them in your foot, and this is called the proximal head of the metatarsal bone, and this region is called the distal head of the metatarsal bone, and the middle part is called the shaft of the metatarsal bone. And so this joint is called the metatarsophalangeal joint. And this is your toe. So this is the big toe. And this is the metatarsophalangeal joint. So when you have inflammation of this bone called the metatarsal bone, it could cause metatarsalgia. And so let's look at some pictures also. So if a person complains of pain around this region of the foot, you are likely to say the person has metatarsophalangeal joint pain or metatarsalgia. So this is how it might look like. So you can see some swelling around the side, which could be very discomforting. Just imagine walking on this swollen area. It could be very discomforting, painful, and yes. So in the case where someone has a metatarsalgia, as swollen as it is, if the swelling doesn't come off, you could have a surgical procedure to be able to take off the swelling and then also return to function. So some of the factors that causes metatarsalgia to occur, we could have tight toe muscles. So if you have the toe muscles being tight, it could cause stiffness and also pain, and it could cause pain around this region of the bone. So a physiotherapist would try and put the thumb around the side, and if the patient complains of pain or the patient has stiffness around the side, we could diagnose this condition as metatarsalgia. Also, we could have weak toe muscles. If you have weak toe muscles around this portion of your foot, you could also have this condition also presenting as metatarsalgia. You could also have, if you have tight structure around your heel region, so around this side, if you have very tight structure around the side, you could also have other structures underneath the foot region also being reduced in terms of their length. So we can see it here, and also if you wear loose or tight footwear, so those who wear probably tight shoes, they are likely to also cause this portion of the foot to be compressed. So as it compress, it will cause discomfort around the side, and this may cause metatarsalgia, but it's not really confirmed other than other tests. So you could use an X-ray. You could also use your hands to check whether it's around this region. So we saw a picture before here. You could see around this region. So if it's around this region, then it could be going into this condition called metatarsalgia. Okay, so let's look at some more pictures of the condition. So as we said, it's around this region of the body. So if the person or the individual complains of pain around this side, because metatarsalgia. And so you can see the therapist is putting the hands here to check whether there's pain around this side, and then so you could have metatarsalgia around the side. So this is the yes, you can see the region around the side. Yes, so around this side, yes, you could have metatarsalgia. So around this side. Yes, so these are some more pictures giving us how or the location of the condition called metatarsalgia. So you can see it here, another one here. Yes. Okay, so you can see it around the side. Okay, another one here. Okay, so another one. another one. Yeah, so this is actually the bones of the foot. So as we mentioned earlier on, I'm sure we will now appreciate it. So the forefoot. So this whole region of the foot is called the forefoot, and then the middle part is called the midfoot, and then the down one is called the hindfoot. So as we said, we have 5 metatarsals, the 1, 2, 3, 4, 5. You can see here, and these are the sesamoid bones we're talking about here. So there are 2 here, 1, 2, and 2. So the condition occurs around this region, Okay, so I'm sure we've had a little of, I mean, an overview of what we are talking about today. So we continue the discussion. So it says that yes, this condition called metatarsalgia actually could happen to anyone. It doesn't really matter whether you are a male or a female, but then the impact on your foot. So if you really engage yourself in activity that means you walking a lot, or as we give an example initially as the basketball players where they jump, and when they jump, they mostly jump with the forefoot, or they land on their forefoot just to prevent the impact on the ground. So also aging. So as you also age, there's likelihood that you have these structures. It's a condition called arthritis, where the bones lose there's a structure called the cartilage in between the bones. They are likely to have this condition called metatarsalgia. So we have so many conditions that could cause or could push metatarsalgia to occur. So we have also tendinosis, plantar plate tears. I'm sure these are all big words, but then these are all conditions that could result in metatarsalgia, where we have pain around the metatarsal region. So we could have also some like where you have a high arch foot. When you say high arch foot, inside your foot has a small raised portion. The inside part of the foot has a small raised portion. The normal one has slightly raised portion, but some people have relatively higher portion at the inside part of the foot, and this will cause a direct impact to the forefoot, where we have the metatarsal region. And as the person continuously uses or walks a lot, or does activity that involve using of the foot, he's likely to cause pain around the side, and this, when reported as early as possible, could result in early treatment, and then it could be resolved. Also, we have so many causes of this foot. So I'm sure if you can ask questions, and also we give you the right answer. Yes, when you ask them privately. There are so many causes of the metatarsalgia. Okay, so as we mentioned earlier on, also we have 3 types of the metatarsalgia. We have the primary, we have the secondary, and we have the idiopathic. When we say primary, the primary type is it could result from birth. Yes, so as we said, we could have shortened Achilles tendon at the back of the foot. We have a structure we call the Achilles tendon. So when it's short, some people have it after birth, having short Achilles tendon, and so this could impact the structures around the metatarsal region, and this will cause metatarsalgia. The other conditions too that occurs, that is after birth, that could result in metatarsal. Secondary one is as a condition, so systemic conditions. That is, we have arthritis. So when we have arthritis, we have osteoarthritis. That is reduction in the so when we have osteoarthritis, where we have reduction in the bone spaces around a particular portion of the body. We could also have metatarsalgia. So arthritis actually reduction in the cartilage content, that is in between two bones. So we mentioned earlier on that we have cartilage in between bones. So when you have this reduction in this cartilage content, it could cause these bones to come together, and this could result in metatarsalgia, where we have it around the metatarsal region. The third one is the idiopathic metatarsalgia, or the iatrogenic metatarsalgia. And actually this actually occurs when someone or an individual or patient has undergone surgery, so where the surgery fails. So maybe the person has had surgery to the foot region. So in the case where maybe a tendon doesn't really heal well, it could also affect the bones, that is where the bones come into contact with each other and cause metatarsalgia. We could also have instances where we have subluxations, yes, where we have the bones displacing away from their normal position. So we have joint subluxations, and then so many causes, yes. And so we should take note. So if you have any pain, complaint of pain around the foot region, especially around the front part of the foot region, that's under your foot, you need to report to the physiotherapist or the medical personnel to be able to treat, yes, this condition. Because if the slightest pain you feel is not reported as early as possible, it could be very disturbing. It could affect your work, it could affect so many things, and if it could affect also your family, because your family might depend on you, and then if you are not feeling well, you can't walk, they also run at a loss. Okay, so other conditions that could look like metatarsalgia, we could have the plantar fasciitis, we could have, where there are other conditions that affect the foot, we could have Morton's toe, systemic arthritis, so many of them. Okay, so if someone comes to the clinic or the hospital and complains of pain on the foot, we have other investigations that we carry out. So we have one called an X-ray, so that we can confirm whether it's actually around that region or there's reduction in the bone space around that region. So you have an X-ray, we can observe through an X-ray. If there's reduction in the space around that region, we could narrow it into metatarsalgia. And if you have reduction in bone density around that region also, and the patient complains of pain, it's actually a confirmatory test for this condition called metatarsalgia. Aside that, as and the patient reporting to the clinic or the hospital, we have something called outcome measure, that the first time the patient comes, we go through the patient. There are so many types, but we have two main types that we use. The first one is mostly used, called the foot function index. It means the second one is the foot posture index. These ones actually are not to a far extent, and so we are still under research to be validated. So if the pain is so intense and cannot be borne by the patient medically, the medical doctor prescribes medication, that is analgesic, to relieve the pain, or the physiotherapist to a better extent uses other non-oral procedures, such as the RICE procedure, that's resting of the foot and then icing the foot. If the foot is not exposed to a wound, the ice procedure is very important, and then this helps reduce swelling and also to relieve pain, and then possibly bandage the affected side to prevent undue movement or excessive movement around the joints. Then we start with other gentle exercises just to relieve the pain and to improve the range of motion, and then other strengthening exercises as physiotherapists. Very importantly, if a person is a driver, we will advise modifications such as using foams around the pedal area.